Humans respond to stressful situations differently. After being exposed to a stressful or life-threatening situation, we may lose some sleep, appetite, and may not feel like socializing with others for some time. But if these side effects last too long, this can develop into a medical condition called PTSD. Post-traumatic stress disorder is a systematic response to a near-death situation or traumatic event, often leaving guilt or shame. Mainly due to stigma, this condition can, in many cases, go undiagnosed. In Canada, it is estimated that up to 10% of war zone veterans, including war service veterans and peacekeeping forces, will go on to experience a chronic condition known as post-traumatic stress disorder, or PTSD, while others may experience at least some of the symptoms associated with this condition. In reality, the numbers can be higher. 24% of all Canadian veterans in receipt of VAC benefits have disability benefits for a service-related psychiatric diagnosis. 71% of Canadian veterans in receipt of disability benefits for a mental health condition have PTSD. 57% of Canadian veterans in receipt of disability benefits for a mental health condition are married or have a common law partner. VAC's history with medical cannabis. 2007. Veterans Affairs Canada makes the decision to reimburse one veteran for cannabis for medical purposes on compassionate grounds. Since then, VAC has been reimbursing veterans for medical cannabis at increasing numbers year over year. 2008 to 2014. Reimbursement for the cost of cannabis for medical purposes was provided to veterans based on Section 4 of the Veterans Healthcare Regulations in accordance with Health Canada's Marijuana for Medical Purposes Regulations, or MMPR. 2014. Health Canada introduced the MMPR, which removed limitations related to the authorization for specific conditions by a specialist. VAC received a large increase for reimbursement requests from veterans nationwide. 2016. Due to increased reimbursement claims, VAC limits daily authorizations to 3 grams per day unless a letter from a specialist requesting more is provided. Are you a military veteran who has thought of using medical cannabis? You are not alone. In fact, the number of military veterans registering for medical cannabis in Canada has never been higher. Whether you're just looking for a medical cannabis prescription to get some relief from major depressive disorder, persistent depressive disorder, TBI, or chronic pain. If you or someone you know is suffering from PTSD and are interested in participating in a groundbreaking medical study that could pave the way for future veterans, please call AVAC today, 1-855-492-8245, www.availcannabis.com. AVAC brought to you by Avail Cannabis Clinics.